Well, you'll know them by their symptoms. And these people come in and they complain of the symptoms we talked to earlier. You know, doc, my eyes burn. After I read for a little bit, I must have a dry eye. And many times they do have an ocular surface problem, but many times it's a referred pain problem in which their the burning sensation that they sense is not a dryness at all, but a proprioceptive mismanagement of their visual system. You have to ask them about their headaches. Many people don't think they're related to their eyes. I mean, many people wouldn't realize that headaches in the back of my head are coming from my eyes, but I will assure you that that is the case. Many of them think they have sinus headaches. So the best way to identify these people is just to sit down and take a good history and talk with them. And once you listen to their symptoms and identify when they're coming and what they're doing, you can usually very quickly, start to assume, or at least start to look under this rock to see if that's really what's causing their problem. I don't think I could ever adequately describe how it's changed what I do. As I've told many, my beginning in optometry started in a lesson in humility. And my father understood this condition very well, and when I got out of school I thought, you know, Dad, that's not necessary. People will adapt to what you get them. But these patients came back and didn't want to see the new young guy to school that knew a lot more about glaucoma and eye disease. They wanted to see the old guy that when they wore their glasses their eyes didn't burn. And from that point on, when I started to understand that when you solve these people's problems, there's a huge impact to that. It changed the way I practice. And when you fix somebody's headaches, you fix Sally's headache sitting in the cubicle, and she figures out that her headaches and her eye strain and her discomfort was caused from the way her eyes are working together. She does nothing more than tell the person sitting next to her. And pretty soon these people start rolling through your offices looking for you instead of you trying to look for them. And it truly makes a difference about how it impacts you financially. It's made a huge impact of what people perceive of how you treat them, and you truly give them much better care. So in the end, the result is a healthy practice and healthy patients and satisfied people. You know, I read an article one time from a physician, and he said, he was a teacher in a medical school, and he said all the first year medical grads that get out of school, their first job should be to deal with headache patients. Because most doctors don't want to deal with some of those headaches, you know. I mean, you feel like it's a very difficult thing sometimes to manage. And contrary to my practice, I love someone that comes in and says, I have a headache. Because I think there's a reasonable chance that I'll be able to resolve that. And when you can resolve these people's headaches, they are incredibly grateful for what you've done for them. And we're currently doing a study with neurology, with a neurologist in Sioux Falls, South Dakota, in the McKinnon Health System. And they're so excited about our ability to be able to resolve many of these chronic headache type patients that we have a clinical study underway. And so when word travels that you're starting to solve these people's symptoms, it opens up a lot of opportunities and a lot of doors for your practice and for referrals from other medical people to help them with the issues that many people struggle with.